Section A is about the general knowledge you have of some of the key topics that we've covered during the semester of XMB 375. And there's 6 key areas that I think are really important and pertinent when it comes to trying to structure your revision for doing the exam. The first area is about looking at the practical skills a sports psychologist would consider when working with a client. So look at some of the material that we've covered in both the readings and during the workshops on things like the ethical issues that sports psychologists have to consider, how they go about building rapport with clients, and also what are the different types of interventions that a sports psychologist and exercise psychologist might encounter with a client, whether these be purely performance-based or more clinical-based interventions, or if these are things like dealing with career termination. The second area I would look for you to revise in is looking at some of the key considerations for designing psychological skills training programs. So by this, I would expect you to look at what are some of the best practice principles that somebody who's putting in a psychological skills training program would have to consider. So the whens, the wheres, the hows, and the whats, and also what are some of the common problems that might be encountered when putting in a skills PST skills training program. What are some of the credentials that a sports psychologist would have to be able to implement it in the first place? And also, how would you evaluate it? So how do you know that it's actually had any impact, depending on whatever training program you put in place? The third area, which is really the what of the psychological skills training program, are what are some of the psychological skills that you need to be aware of? So of course, things like goal setting we've talked about. So I would expect you to look at what are some different types of goals that are involved in goal setting. What's the theory underpinning goal setting? What are some of the common problems in helping people set goals effectively? And within goal setting, a major area we spoke about during the start of the semester, or certainly the first few weeks, was performance profiling. So what is performance profiling? What are some of the principles and processes that you need to go through to implement performance profiling effectively? Other skills beyond goal setting would be skills like imagery. Again, a bit similar. So what is imagery? What are some of the underlying theories that explain the effectiveness of imagery? What is its potential impact in regards to helping people perform better? And what are some of the different types of imagery as well? And finally, what are some of the best practice principles you need to consider when implementing an effective imagery program? Other areas in terms of psychological skills would certainly be looking at techniques for helping athletes and people cope with anxiety and stress. So we think about things like some of the emotional regulation strategies like progressive muscle relaxation. We looked at the stress process, so how people cognitively appraise stress through that primary and secondary appraisal processes. We discussed things like biofeedback and also techniques like mindfulness, where Thomas talked at length about mindfulness too. Regarding exercise populations, some of the techniques that you might use with exercise populations would be things like motivational interviewing. So what are some of the principles in and around motivational interviewing? And what is it fundamentally? What is motivational interviewing and how is it different to other psychological skills and techniques? So that's the first 3 areas. So practical skills as a sports psychologist, some of the key considerations of designing a psychological skills training program, and also some of the psychological skills and common psychological skills that we talked about. The fourth area would be having some knowledge in and around the psychological constructs such as personality. We talked a lot about McAdams' 3 layers through some of the things I talked about, but also Professor Cliff Mallett's presentations. Confidence, so what are some of the sources of confidence? What are some of the different models and techniques for improving confidence? We talked about motivation too, again, different types of motivation, especially within self-determination theory. And what is an autonomy supportive coaching environment? What are some of the techniques that help shift people be more self-determined or intrinsically motivated? And what are some of the coaching techniques that you might implement to make that environment more autonomy supportive? We also talked about concentration too, and covered concentration. So some of the theories that underpin understanding people's attention and shifts in attention. What impact does stress have on concentration, and in particular that relates to the choking process. So understanding what choking would be good. And also what are the different types of attention. So when your attention shifts from very broad and external to narrow and internal, what are the different types of attentions that are involved there, and where did that theory come from and model come from in the first place? The fifth area we talked a lot about was, especially with Jason, and we looked at the video of Lindsay Vaughan, was injury. So understanding what are some of the psychological considerations of injury and what might a practitioner do in helping trying to understand somebody who's going through injury. We'd also look at the different phases of injury an athlete might go through. So from that initial onset of injury through to the adherence issues of rehabilitation, and then finally that returning to injury. So understanding some of the things that you might do as a sports psychologist to help somebody through those phases. And lastly, just throughout the semester at different phases, we completed different questionnaires, especially related to things like personality. So we did the MBTI, the Myers-Briggs Type Indicator. Again, what is that and why would you use that? We looked at inventories for confidence and different sources of confidence, and also motivation, understanding where you lie on that self-determination continuum. And so there's those particular questionnaires, but more broadly, I'd like to have a bit of an understanding and to reflect on when would you use assessments generally, and what are some of the key principles a sports psychologist should consider when thinking about using a quantitative assessment item, an instrument, with an athlete or a client in the first place. Why would you do that, and how would you use that particular information?